Hello, my name is David DeStefano. I'm the President and CEO of We Are Sharing Hope South Carolina. We Are Sharing Hope South Carolina is a nonprofit, mission-based organization responsible for facilitating the gift of life in South Carolina. Our job in South Carolina is to educate the community on donation, is to advocate for donation with our hospitals, our families, and our donation partners, and to coordinate the gift of life for those who want to be a donor and the recipients who are waiting for their second chance. An OPO is an organ procurement organization. It's the entity that facilitates the gift of life at the end of life for patients in South Carolina. We are the bridge between the donor hospital and the transplant centers to help facilitate that gift of life for those organs being donated from the hospital and transplanted to recipients at the transplant centers. It is important to remember that organ procurement organizations like We Are Sharing Hope South Carolina do not care for living patients. Our role is to care for the families of those patients who've died in local hospitals and facilitate the gift of life between the donor patients and the recipients at local transplant centers. We do not declare death, and we're not responsible for the patient care. That separation between patient care and recipients is crucial to making sure that organ donation in South Carolina is ethical, safe, and effective. The question is, how does We Are Sharing Hope South Carolina interact with our hospitals and our families in our local community? The hospitals will call We Are Sharing Hope South Carolina when a patient has died or when death appears imminent. We Are Sharing Hope SC will send staff to those hospitals to evaluate those patients to be able to donate organs for those recipients who are waiting. If the patient is suitable for donation, we will then engage with the families, care for those families to provide care and comfort at the end of life, and advocate for donation for those recipients who are waiting. If the family says yes, our staff will manage and coordinate the donor patient and help build a bridge between the hospital and the transplant center by making organs available and offering those organs to waiting recipients. We Are Sharing Hope South Carolina will then coordinate those transplant centers arriving at the hospital to help recover those gifts and get them to the recipients who are waiting. I think it's important to point out that organ procurement organizations' responsibility rests exclusively with the donor patient and their family. OPOs don't make transplant decisions. Those decisions rest squarely with transplant centers, who are responsible for making decisions about who and when their recipients are transplanted. Organ donation is a miracle for some. It's the opportunity to leave a legacy beyond oneself and to save the lives of those waiting for their second chance. If you're interested in learning more about becoming an organ, eye, and tissue donor, or more about registering to become a donor, please visit our website at sharinghopesc.org.